In today's podcast, I talk to Frané Clarke, who is a professional midwife. Frané is also the midwife that helped me and my wife deliver our baby at home with a natural birth. And I have to say the whole process was extremely well orchestrated and done very professionally. And I think that the topic of natural birth and midwives is a bit of a taboo in South Africa and in our culture. And for that reason, I wanted to have Frané on to give us a little bit more clarity around the topic. And she discussed a lot of things like the pros and cons of natural birth, as well as the pros and cons of C-section. I really enjoyed this interview and I find her very insightful. She knows a lot about the topic and she's very well informed, and she is also very open to discussion around the topic. So I enjoyed this. I hope you do too. Enjoy the show. Frané, welcome to Challenge to Champion. I'm really excited to have you here and I feel honored that you came to speak to me today.
Thanks, LaRue. It's a pleasure to be here. Always nice to have your voice heard and to get conversation going.
Definitely, and especially in your field where I feel it's a bit of a taboo topic maybe in our culture, and I really don't know why. One of my main thoughts, and I have it in between some of my questions here, but one of my main thoughts is it's probably educational. People aren't educated on giving birth and what are the options and what are the alternative options, and of course pros and cons of these options. So I think a big thing, and that's what I want to get into today, is basically what are the options for pregnant women? What are things that they should consider? Because of course, and I definitely, we spoke about this a little bit before we started recording, but I don't want to put any doctors or any hospitals or anything by this, having this conversation. I don't want to put them in a bad light.
Yeah, absolutely.
But also I want to shed light on what you do and how we found that tremendously valuable, having you there and allowing us to have a home birth. I know that all natural births aren't home births.
Yes.
It can also be in a hospital, but like for our situation and me being in a wheelchair, just having my wife know that I'm sorted and that I'll be able to do whatever I need to do, however long the birth takes.
Yeah.
And that gave us a lot of flexibility and comfort during something which probably most of the time is quite a stressful situation.
Absolutely. I do think that's a good place to start, and I think to start off with, it's important to just mention, and I always say this during my antenatal classes as well, sometimes when we talk as midwives, we may come, forward as a little bit anti-gynae, but that is not the case at all. There are amazing gynaes in South Africa, gynaes who are pro-natural, gynaes who will let you have your natural birth in a hospital setting, but unfortunately, we do have a very high cesarean section rate, so one of the highest in the world, and that is something that we just want our mummies to be aware of, is that if you want a natural birth, home birth isn't for everyone, and you absolutely can have a hospital natural birth, but then it's so important to make sure you choose your team correctly, just to know that, okay, my gynae is actually pro-natural.
And that you probably educate yourself on what will be told to you, because I think you come across this a lot of the time when you're in a hospital setting. The fear mongering that happens in there is quite bad, and I think some cases, of course, it's valid, but other cases, in my research and when we were having to bear a child, we got a lot of influence from doctors saying that this is going to be a problem and that's the issue, and for these reasons you shouldn't do a natural birth. And that is even before looking at the person and before even hearing if they want to do it, if they are able to do it. And it's a lot of being pushed into this direction. And from my side, I can see a bunch of reasons why it would be beneficial for them.
Yeah.
Getting a specific time of birth, financial benefit. Of course,
Absolutely.
it costs a lot of money to go into the hospital to get the gynecologist to do the birth.
Yeah.
So there's a lot of incentives on that side.
Yeah.
And that always is a bit of a red flag to me.
Absolutely. And I always say to people, I understand as well, like, I'm not sure what the insurance costs are overseas, but in South Africa, if you're a private gynae and you're having to pay, the liability fees, it's ridiculously high amount. So lots of gynaes will just say, you know what, for me, it's not worth it. It's
Yes.
not worth the risks associated with natural birth. So they rather just opt for cesarean sections. It's easier. We can go, before it's Christmas, we can quickly do our list of C-sections. And I don't have a problem with that. But again, it's just about them being open. And then when a client does approach them to say, you know what, actually, I'm more pro C-section. If you're looking to do natural, then go to a doctor who is more pro natural. Because at the end of the day, the feeling that I get from lots of my mummies who attend my classes, for example, they come from gynaes, they come from midwives, and they attend my antenatal classes. And oftentimes, they have the feeling that having a natural birth is more risky. Like, it's
Yes.
more unsafe for the baby.
And that's how I felt as well. Remember when you came to us the
Yes.
first visit, I had a bunch of questions because that's how we are informed
Yes.
by, you can call it propaganda, or
Yeah.
you can call it, that's just the available information.
Yeah.
But we are scared about the multiples of things that can go wrong.
Yeah.
And you did a very good job of settling a lot of those fears for me, because I think we get the perception from maybe movies
Yeah.
a lot of the time, where you see, say someone is doing a home birth, or they're on their way to the hospital and they're giving birth, and it's chaotic and it's
Yes.
life-threatening, and it's a bad setup.
Yeah.
And the way you explained it to me gave me a lot of clarity about timelines and progress
Yeah.
that the woman who is busy giving birth, you can easily measure progress stages.
Yes.
And that gives you clear indication, is she making progress? Will there be any issues? And then even if you have an issue, then it's not an emergency. Listen, we have 20 minutes.
Exactly.
We need to get in the car.
Yeah.
and-
It's not like the pawpaw strikes the fan
Yes.
in 5 minutes you have to make life and death decisions. And I think that is what scares a lot of people off, and especially fathers. That's usually the concern they have is this safe? And I always tell them, we've got red flags that pop up if we are going to have them during a labor. And then as midwives also, we're not... Again, the movies give us this idea of we airy-fairy people who stand around and, we've got our incense going and we're lighting candles. And our job at the end of the day is actually to make sure that mom and baby are healthy. So I always tell people, the fact that you're choosing a midwife doesn't guarantee you a natural birth. It doesn't guarantee you a home birth, for example. But it guarantees you that during the process, we're going to make sure that you and your baby are safe. So if there are any things that pop up, any things that go not according to how we want it to go, or things are happening a little bit slowly, we can start with our interventions at home already, to still give you the highest chance at your natural birth. But at the end of the day, if we see, things are going not according to plan, something is now either threatening the mom or the baby's safety, then absolutely we do transfer to hospital for further management. And that's at the end of the day, something that we only know during the labor. So oftentimes when you go to a gynae and they say to you, but this can go wrong, and this can go wrong, and this can go wrong. And it's often things like, but daddy is so tall and you have such tiny feet, so how is this baby going to fit out? This baby has a giant head. All those things will scare you into thinking, maybe C-section is the better option. But when it comes right down to it, we only see during labor if that baby will then now be born naturally or not. And most of the cases they are.
Yeah, what about the physicality of it? Because I've seen a lot of women that are really small women, and one of them specifically have given natural birth to 2 sets of twins.
Goodness.
Separate occasions. And nothing is fine, and that I think is mostly because her husband is a rugby player, and they were in Europe. I think they were in France or I think it was France.
Okay.
So, of course, in those countries, it is natural birth. Only the exceptions get a C-section.
Absolutely.
So, the fact is, if you see a lot of people abroad and in our country, then you have a lot of case studies where small women did give birth naturally, and that wasn't the problem. But that seems like a valid reason. No, you shouldn't do it.
Yes. And I mean, I had this in January now, one of my mommies who gave birth, and she was so terrified because each and every scan she went for, people would tell her it was gynaes, it was sonographers, everyone would tell her this baby has a giant head. And she was so fearful. And she did end up having quite a large baby who was 4.09 kgs for a first-time mom who's quite small in stature, but again, at the end of the day, the body usually allows for these babies to pass through the cervix. So I always tell people, you must remember, during the laboring process, and not at your last scan, this is during labor happening, we've got basically your pelvis kind of shifting open a little bit more. So all of the smooth muscle, all of the ligaments in your pelvis kind of moves out of the way for the baby to pass through. Plus the symphysis pubis, which is like a cartilagey part in the middle of the female pelvis, will actually expand, and that can expand by up to 1.2 centimeters. Now 1.2 centimeters sounds quite small, but for a pelvic outlet, that's quite a large amount of space. And then to top that off, we also have what happens in some babies, we call it molding, and that's where the head shape of the baby actually changes. So instead of this little round head coming out, the baby's head will actually elongate, and it doesn't squash their brain in any way. It doesn't squish their head. It actually just changes the shape, and that molding can allow for another 1.2 centimeters of space. So when you think about it, 2.5 centimeters almost of space that is created during the laboring process. And some of these large babies come out and they don't have any molding, meaning they could have still probably grown a little bit and still fit through the pelvis. So it's absolutely amazing, when you witness that.
I think maybe a lot of the impressiveness of giving birth and a woman's body is being taken away by not giving that opportunity. I've also thought a bit about the empowerment of the mother being able to go through that natural process. How big of a role do you think that plays?
I think that is amazing. I always tell people, I think birth is 90% in your head and 10% in your body, because it's so much mind over matter. And this is why we often, I believe this is why midwives actually often have higher success rates when it comes to vaginal birth. I don't think it's necessarily only the midwife allowing more time or, being more gentle in their approach, but I really think most women who choose to birth at a home or at a birthing unit, they do more research on the topic, so they're much more prepared. And I always say, it's such a beautiful experience. Most moms at some stage during their laboring process will tell you, I can't do this is too much, it's too painful. But at the end, every single one of them will tell me that was one of the best experiences of their life, and they are so proud of themselves. So it's such a beautiful thing to see, and it's one of the things that actually hurts my heart the most when I hear about gynaes pushing a bit for C-sections, is just it's taking that sense of accomplishment away from the mom.
I think for my wife as well, having the whole birth, and that's why we decided on a home birth, having the whole birth very medicalized. And I don't know if most people have been in a hospital like we have, and we have had a bit of trauma with hospitals. So firstly, it's not a calm environment for us. We connect a hospital to trauma, and
almost PTSD a little bit.
Yes. I know that hospitals are actually there, and probably it's the reason why I can still be alive as well. So, yes. I mean, hospitals do a lot of good, doctors do a lot of good, but I think not every situation requires that. And of course, afterwards, speaking to my wife, it was an amazing, wholesome experience that she had by giving birth, where her baby was not immediately taken away, and I don't know, all the things that they do with the baby immediately after birth. Well, we could have had it was a really relaxed time, and it was actually very relaxed. I was surprised by, I don't know, the amount of endorphins and dopamine and everything that went through her body, but she was so calm and relaxed and happy. And it was just a great experience for us. And for that reason, that's the reason why I'm actually having this conversation with you, because we had a really good experience. And I think with my wife being so interested in this field and in women's health and all of that, that actually allowed us to consider that, even because she's very knowledgeable on all of these topics.
Which
and
helps.
everyone can't do that. Everyone in say who's a standard lawyer or doing a standard career, they don't have time to do the research on all of these things. So how would someone in that position go about getting information and getting the knowledge that they can be safe in this?
And it's such an important question, because I have so many people running to Google, which, I mean, it's amazing. We have the internet, we can do our own research, but you can easily find both ends of the spectrum. So I always say, if you Google, is vaginal birth dangerous? Of course, everything's going to pop up that makes it dangerous. So I always say to people, really, for me, I believe that the first step is antenatal classes. And not everyone presents the same topics at their classes. Not everyone covers everything. So just doing your research is a good start on antenatal classes that are comprehensive. I see that lots of clients do classes through the hospital where they are birthing, which for me also, I always say you can do that, but maybe as a top-up, do something privately as well.
It will be already a bit skewed.
Exactly. I mean, I presented classes before my little one was born. I used to present classes at one of the Joburg hospitals. And after like a few weeks of presenting the classes, one of the doctors actually phoned me and he said, like, are you the midwife who's presenting the classes? So I said, yes, no, I am. Like, how can I help you? He said, are you teaching the moms about skin to skin and delayed cord clamping? I said, of course, it's two very important topics. I touch on that quite in depth. And he said, well, he wants that to be removed from the class slides, because all his mommies are coming and they're demanding skin to skin and they're demanding delayed cord clamping, and it's taking time, off his work schedule. So that to me again is just a sign, that people have their own agendas a little bit.
Yeah, and if the only thing that cause you not to do it is the time and the schedule of the hospital, but there's a lot of other benefits to it.
Exactly.
I don't know if that makes sense.
Exactly. It's like you have to look at the greater good at the end of the day. And that's why, you were speaking about the interventions that happens with a newborn after delivery. And when I teach my classes, I do know lots of gynaes have referred clients to me. And then after referring a few clients, they've said, oh no, it's too much that clients are demanding, but it's our right to do that because that's what's best for our babies at the end of the day. So I always feel like if gynaes were just to look at these things of delayed cord clamping and waiting with, weighing and measuring the baby, none of that needs to happen in the first hour. Most of that can happen while baby is on mom's chest, whether it's a natural or a cesarean birth. So overseas, again, where they're a little bit ahead, they'll do what we call a gentle cesarean section. So they try to have that calm environment. They try to do most of those checks on the mom's chest. They try not to separate mom and baby in that first hour. So if we were to just move towards that, I feel like I would already be less against C-sections in a way. But unfortunately, they're not done like that by most of our gynaes. Again, there are those that really are pro-natural, but oftentimes in hospitals, it's kind of time is money. It's understaffed as well, so they can't necessarily afford to have a baby staying after the C-section with mommy, because if the baby is staying with the mommy, the midwife from the labor ward has to stay there as well. And so all of these things absolutely do factor in, but we could definitely make the hospital experience a little bit more comfortable and relaxing as well.
Yeah. Do you do a lot of births at hospitals where you play the role as a midwife?
No, I don't. And there are midwives who do that. Midwives Exclusive is one of the big like companies, if I can call it that, or institutions in South Africa that does that. And so I refer lots of mummies to them. The reason I don't do it is, firstly, hospitals are not too keen actually on private midwives. I think sometimes they also look at us like we come in off the street, without an education half. So when you do step in there, you have to sign lots of paperwork, and you have to still kind of go by their rules and regulations. So you're there, but I found that when you birth in hospital, your chances are higher of getting a C-section. So for me, that was very much demotivating, because you do all these sessions with your client and you're so keen on having this natural birth, and then oftentimes it would end up in a C-section where I would feel like we could have given more time, for example.
Does that feel like a failure to you?
Yes. Yeah, it does. It does.
And on the mother's side?
I think as well. And, even I always tell moms, even with a home birth, for example, and this is when it happens. I've had quite a few times where there's a mommy that needs to be transferred, whether it's a baby that went into distress or a baby that now actually is not fitting through the pelvis. And you transfer because you now have reached that point, but you do feel like a failure. And I do think sometimes the mommies, obviously they go through that like grieving process of not having this natural birth. And I do think sometimes, I always tell these moms, I reach out to them and I want to do debrief sessions, but oftentimes they'll associate you with that trauma as well, which is completely understandable, but tough if you're a sensitive person to deal with those emotions. So I always say, and I know lots of my colleague midwives, are seeing psychologists to also work through those feelings of disappointment.
I can think, yeah. And I would reframe that in my mind if I was in that situation, because it would make sense to me that we have a place for emergency in our whole plan of giving birth. And if we need to go to hospital for that emergency, and still then being able to have a healthy wife and a healthy baby, I would see that as very successful.
Absolutely.
I would still see that
absolutely
as successful.
So I do recommend that these mummies go for post-birth trauma counseling, essentially, to work through those feelings of disappointment. And I always tell them as well, it actually, sometimes you feel like a failure as a mother because you've now done your research. You feel like natural birth is the best thing for your baby and for your body. And so you go through this process, you end up with a C-section, and then they feel like they're already a bad mother. And I always tell them, actually, it's quite the opposite. The fact that you are willing to say, you know what, I'm letting go of this dream of mine or this ideal I had in my head, and I'm pivoting and I'm going with plan B, is actually like a sacrifice that you're making for your child already. To top that off, I always tell moms as well that if we've gone through the laboring process, your body has already, these hormones have been released. Your body's already starting to prepare for babies on their way. And that's another great thing that we don't get with an elective C-section, because baby is in 1 minute and out the next minute the baby is in your arms. So that body doesn't have the time to adjust to say, okay, the baby is coming. We need to start getting the hormones ready for milk production, etc. So I always try and focus on those two positives of you made a sacrifice because that's what's best for your baby, and secondly, your body at least knew your baby was coming. So already we've
process
won there.
going.
Yeah, which makes things like breastfeeding at the end of the day easier. So we do see with C-section moms, we do have lower breastfeeding success rates, and I do think that that's one of the things, is that mom's body is not going through that laboring process. And secondly, of course, our babies and moms are being separated after the C-section.
Do you think that women are being told this beforehand when considering a C-section? Listen, that this might be more difficult, this might be a bit of a problem, this might be an adaptive phase that you need to, or these are other measures that you need to do now because you did the C-section, or is it just, sorry, here's your baby, figure it out?
Yeah, unfortunately, I don't think it's really being discussed. I think if all care providers were to very honestly speak about natural birth versus C-section, the pros and the cons of each, firstly, that's what everyone should be getting so that they can just make an informed choice.
Yes.
But I think lots of gynaes will just, if a patient says, I'm going to have a C-section because I'm scared of pain, they're going to say, oh, okay, no, that's great. You know, we do C-sections. We know there's no like major risks associated. They'll rather highlight the positives of it than to talk about the negatives.
Can we do that? Can we go through both the natural birth pros and cons and the C-section pros and cons?
Yeah, we can definitely. And I mean, I deal with C-sections so little that I probably, if I Googled it, would have more answers to say. But just from the feedback I've gotten from my clients.
Yeah.
So natural birth, pros, best for mom and for baby, meaning the smallest risk for complications. And this being said, sorry, I should just mention, so as midwives, we do low risk deliveries at home and at birthing units. So if a mommy has a pre-existing condition of gestational diabetes or high blood pressure or whatever the case may be, that mommy is considered as high risk, and obviously then we are not going to take chances. So she will then be delivering in a hospital setting. And then we can kind of still support and try and, get the most natural birth we can with that, but we only do low risk pregnancies. So with that being said, natural birth, we have lower risk for complications with both our mommy and our baby. Things like breastfeeding, things like bonding, all of those things tend to happen more easily. We've got less, postnatal depression. Okay, so mom's mental state. And that goes hand in hand again with the breastfeeding, for example, where with a C-section, we know that a mommy's milk comes in a day or two later than with natural birth.
Because her body didn't know she's giving birth.
Exactly. So oftentimes, mom will panic because there's no milk yet. So she'll start giving formula. And as soon as we give the baby formula and their tummy is full, they're not very interested in being on the breast anymore. So all those things happen.
How long does a mother have then to get the baby to drink breast milk so that he doesn't get... not satisfied, but used to the formula milk?
Yes, well, ideally we would not give any formula milk at all. Okay, and that is why during the classes I also try to teach this, is if you know your milk is going to come in a little bit later, it's not a problem. You just work with what you have, because that first breast milk is called colostrum, and I always say it's like a superfood. It's almost like a stock cube. So although it's only coming out in drops, for that baby it's still sufficient. It's still enough for adequate nutrition. So we just have to kind of wait it out and make sure we put baby on the breast often. We don't introduce the dummy too soon. So if we just educate a mommy on this, then we can already deal with that situation. But because we're not talking about it and we're not, preparing the mommy and saying, look, this is something that happens with C-sections, we have a mommy who goes, oh, it's already day 4. I've heard your milk needs to be in by day 2 or day 3. There's nothing there. Let me give formula. All of these things tie in together. Skin to skin is another big benefit of the natural birth, is that with skin to skin, or with natural birth rather, we usually do skin to skin immediately following the birth. We'll do some delayed cord clamping, which also is a scenario that mostly happens with natural birth. In the theater, it's cold. They want to kind of get baby wrapped up and warm as soon as possible. And those things in itself helps our baby. So let me talk about skin to skin first. So skin to skin, if you Google, the list is as long as my arm. Main things are babies are getting their heat from the parent, and this is even skin to skin with dad. So with a C-section, I educate the parents and say, whenever baby is in the ward and mommy is still in theater, maybe they're busy with suturing, daddy must do skin to skin. Because if a baby is getting their heat from their parent, they don't have to generate their own heat. And if they don't have to generate their own heat, their blood glucose levels are staying more constant. Whereas oftentimes with the C-sections, and this can happen directly following the Caesar, or even that first night or two in hospital, the staff might say, you know what, you had the C-section, you have to rest, you've got medications that are making you quite loopy. Let's take the baby to the nursery and we'll bring the baby to you for feeds. which they don't mean it out of a mean place. It's out of concern. But now they take that baby is sleeping, and they see, okay, this baby is actually now sleeping for a little bit longer than we would expect. Let's check the baby's glucose levels. And sure as Bob, baby's glucose levels are low because they are generating their own heat. And instead of going, okay, let's run to mommy, express some milk, get baby on the breast, they rather say, okay, we're going to give some formula top up because this sugar is now low. And then that whole cycle starts of baby's tummy is full, baby doesn't want to breastfeed. So yeah, it's a whole like domino effect actually when it comes to this.
And it progresses to more difficulties.
Yes, absolutely. And then we have the flip side of it, where nowadays gynaes are going, okay, we know that C-sections are making a mommy's milk come in a little bit later. Let's give medication to actually increase their milk production sooner after delivery. So then they do this, but now oftentimes, mommy will start drinking this, and when her mature milk then does come in, she sits with engorgement, which basically means the breasts are hard and full and painful, and she feels like she has an oversupply. And oftentimes our moms will go, okay, this is not nice. I'm just going to hands off for a day or two. I've maybe got some milk in the fridge, or, we have some formula. We'll give that until this situation is cleared up. And that's the worst thing you can do, because when you don't take that milk out, that often will lead to mastitis, which now is when most moms will have to get antibiotics. Oftentimes they have to be admitted. They've got fever. They're physically ill with their little newborn, and they will just say, I'm calling it, breastfeeding is not worth it. So even when we're trying to help on that end, it's such a difficult thing. So skin to skin in itself, and that little bit of time that we have to spend with the baby is number one. Secondly, the medication. So with a natural delivery, most moms don't need to really use pain medication or pain relief afterwards. I do generally give my moms pain relief, especially if they've had stitches done. So if there's any kind of tearing and we need to do stitches, obviously that's painful. But with a C-section, there's no doubt about it. So they give these moms pain meds, and quite strong pain meds, because we want them to be pain-free. But that not only affects our mommy, who is now drowsy and sleepy and struggling to get up to, feed our baby, it also goes to the baby via the breast milk and makes them sleepy and drowsy. And so now you have a mommy who's trying to feed a baby. She's tired and falling asleep. We have a baby that doesn't want to stay awake for feeds. So that, I would say, is one of the big things about C-sections as well. Okay.
It totally complicates it. And
Yes.
Already complicated situation where we did everything natural. My wife had no medication. You see this every day, but when I saw my own wife going through this, I got tremendous respect. It's incredible what women are capable of. And if men were doing births, there would only be C-sections.
Yes, my husband said the same thing.
That would be an app on your phone.
Yes.
Book a C-section. Thank you. Get this one.
Yeah, and it's so sad, because I often get that where moms say to me, "Oh no, I'm getting a C-section because I'm too scared of the pain," and then I go, "Oh, okay, I understand it." Because you don't know what to expect when it comes to labor pain. Oftentimes people ask, how painful is it? No one can say, because we all experience pain differently.
Have you experienced something similar which you can reference it to?
No. I can't. And the thing is, even when it comes to labor, I'll get lots of mummies who say, oh, the pushing part's actually not so bad. It's the contractions that are, because it's so repetitive, that's what really gets to you. Whereas for me, and then some of the other mums I've heard of, I felt like the contractions weren't too bad, and the pushing stage was actually the hard work. So even with, how many mums, I don't even know how many babies I've delivered, each of their experiences will also be different. And so one thing I do often hear is that moms tell me right when they thought they couldn't anymore, like right when they thought this is it, they're calling it natural birth, not happening, that's when the baby comes. So it really does push you to your limits. But yeah, there's nothing I can compare it to. I always tell people, I think the word contraction is a good description of what a contraction feels like. I sometimes say it's like a calf cramp, but your whole tummy and lower back just, contracting. So I do feel like that's a good description. But describing the pain or the discomfort is quite impossible.
It was very interesting to me when my wife was giving birth. I think we were in about 7 hours or something like that. You came at about 12 in the evening, and we gave birth at about just past 7 in the morning. So that is actually a very quick birth for the first birth and a natural birth. But during this whole procedure, it's like my wife was in a trance almost.
Yeah.
And that is on no medication, nothing at all.
Yeah.
And then it's again a positive statement towards what your body is able to do if you allow it to go its natural course.
Yes.
And again, I say this, I understand not everyone is able to do this, but I'm just giving our experience, and we were fortunate to be able to do this. But even though she was in this trance state, which she doesn't remember everything like minute
not
to
at all.
minute, but she told me, I think it was like 6 o'clock. She told me, like, between contractions, I don't know if I can do this anymore. And then I went to speak to you, and I told you, did you check? How far are we along? And you said to me, might be around 10 o'clock we have a baby born. And then I thought, I'm not going to tell her that because that's not what she wants to hear. But then you and the doula just went and talked to her, calming her down, telling her, listen, don't worry about when he's going to be born. Just focus on the next contraction, do the breathing. And she totally settled down again. And then, like, in the next 45 minutes, the baby was born.
Absolutely.
But that was so impressive to see. Firstly, the team that she put together. I think that is tremendously valuable. Getting the right people, making sure everyone's on the right page.
Absolutely.
This is the result that I'm looking after. I want, and that's the conversation that we also had.
Yeah.
We want to give natural birth, but above that is the health of my wife and the health of the baby.
Yes.
And if at any time during the process you see any risks, and you told me that these things we'll see way ahead of time. So it's not a panic situation.
Yeah.
We're going to be calm. You have a bag ready. Listen, it's not progressing the way it is. We need to go to the hospital.
Yeah.
Let's get it sorted there. We want everyone to be fine. Luckily, that wasn't the case. But everything was so well orchestrated, especially from your side. And I think if more people hear that version of it, and how peaceful and calm, and it's not medical, it's not an operation.
Yeah.
And again, I understand that some people have to do that, but everyone doesn't have to do that.
Yes.
Like this, the stats in South Africa, I think it's about 80% of births in hospitals are C-sections.
Yeah.
Then I saw another stat where if you look at all the births in South Africa, not only in private hospitals, it's about 40% that get C-sections. So that's, again, a lot less.
Yes.
Because we're looking at rural areas.
Government facilities, our clinics, all those things, yeah.
And then that is a very good argument to make. Listen, if all these people that don't have the financial means to do a C-section, you can't tell me then that people need to do it.
Yeah.
The majority of people will be able to do natural birth.
Exactly.
And they are capable of it, but they are being told that they can't.
Yeah.
And that it's dangerous. But on the flip side, I don't think people are being informed about the negatives or the bad parts about the C-section.
Yeah.
And then it's just afterwards, sorry, this is what you signed up for.
Yes.
But they didn't know what they
didn't
signed
know.
up.
That's the thing. And that's, I remember when I was a student, I did a, a research study on informed consent. Because even with normal operations, you would be shocked to see, how many people have signed their informed consent like informed consent, for whatever, a leg amputation or a heart operation or whatever. And then when you go and talk to them and you ask them about the risks and the benefits and all these things, they have no idea. So I think that's something that we really need to work on, is just pros and cons and people making decisions based on that, not giving half information. But yeah, you touched on a whole lot of important things there. And something I just think we didn't talk about is that we always do have our backup plan in place, and that is important. So
the safety aspect
that is number one. That is
definitely.
number one. And I think that that's one of the biggest things that has helped me deal with my sadness that comes with having to transfer moms is, and I can't remember who said this to me, but someone said to me, just remember, your job as a midwife is not to guarantee anyone a natural birth. Your job is to guarantee mommy and baby safety during the delivery process. And that really made me think, yes, because if all deliveries went well, then I wouldn't need to have a job. There wouldn't be such a job. So my job actually is to identify when things are not going right and to transfer in that situation. So yeah, choosing your team, number one, very, very important. And that's why I say home birth is not for everyone. A midwife-led birth is not for everyone, but absolutely just making sure that you and your team are on the same page as to what your goals are and what you want out of the birthing experience. But knowing that even if you go with a midwife, we're never going to say, okay, baby is not coping with labor, but we really want a natural birth, so we're just going to keep going. Not at all. Our job is to make sure that mommy and baby are safe.
Have you had a mother that's trying to give natural birth that was maybe a bit too steadfast on doing that, and it could be harmful for themselves, where you needed to tell them, listen, we're not going to do this?
Yes, I have had situations like that, and I always tell people that, to an extent, if for example, mommy and baby are doing well and we see labor is progressing a little bit slower than we want, then we can say, okay, mom and baby are doing well, we can give a little bit more time. But at certain points, I have to follow my guidelines, of course, and at certain points the guideline is to transfer at this stage, and then we have to transfer. So I have had situations where I've had to say to the mom, listen, I understand that you still want to opt for the natural birth, but looking at all of these things, we've done what we can to try and help the situation, and none of it is helping, so we need to transfer. And then at that stage, if we transfer to a hospital, whether it's our private gynae who's backing us up or our government facility, and they still give you some time there, that's fine. But we have our protocols, and that is to keep the mommy and the baby safe. So I have had situations like that. Yeah.
Sorry, I interrupted you while you were busy with your previous point.
I had so many things I wanted to say. I should have brought a notebook as well, because you said so many things. The other thing I wanted to touch on is just you mentioned that it seemed like your wife was kind of in a trance.
Yes.
And I get that from so many moms, and even myself. My first labor was 16 hours, and looking back, even from the day after the delivery, it felt to me like I was in labor for maybe 4-ish hours, and that's all hormonal. So that's because we've got that oxytocin, that feel-good hormone flowing. We've got the endorphins going. And all those things kind of do put you sometimes in a little bit of an outer body experience.
Yeah, like you would get from some types of meditation and so forth.
Absolutely. So,
and that is just made by a body, because it's a natural process.
Absolutely. So yeah, that's amazing to witness. And even when you mentioned, I was guesstimating and saying like maybe around 10 o'clock baby will be here, because we know that first time labors especially do take time, and I never want to tell someone baby will be here in the next hour and then they still have to labor for longer.
3 or 4 hours, definitely.
Yeah, but even that, you mentioned that you were chatting to your wife, and then Natalie and I were the doula were chatting with your wife. And I think oftentimes that's all that's needed, is just, that reassurance to say that you are okay. everything is under control, you're doing well, and just to focus on the next contraction. Because
and especially because you know what needs to happen next, how far are we in the process, so you know that everything's on track and you're happy with how everything is, but you need to resecure the patient basically and tell them, listen, everything's, I know you're in a lot of pain, but everything's going according to plan. This is how birthing feels.
Yes, absolutely. And I often get that with dads as well, because the husbands will often say to me, is this normal? Is this amount of pain normal? Are these groaning noises she's making normal? It's all normal. And I think that's what makes having a doula, which maybe you should have a doula on as well, because they're amazing, especially with first-time moms.
Let's go into that.
Yeah.
What is a doula?
So a doula basically is a birth support partner. So oftentimes people confuse a midwife and a doula, and they'll phone me and say they want to use my doula services. So I'm not a doula, and doulas are not necessarily medically trained. Some of them have done medical degrees or studies in the past, but their main function is to be with mommy kind of on an emotional and physical level, to reassure her, to help her through the laboring process. And they've got lots of little tricks and things in their tool bag that they use to make the labor as comfortable and as pain-free as possible, and to ensure that we kind of on the right track. So I mentioned Natalie. I love working with her. She's an aromatherapist, which means she comes with her little bag of oils and herbs and things. And there we have then a whole extra set of options when it comes to natural pain relief methods. If mommy is feeling nauseous, for example, she's got oils that can help with the nausea. She's got oils that help with mommy feeling lightheaded or feeling overwhelmed. So that's great to have. And then another great thing that they do is they help to get our baby into an optimal position. So I'll often tell Natalie, look, everything is great here, but our baby is still very high up. So if baby can move lower into the pelvis, things will progress a little bit quicker. And then she has massage techniques and little exercises and rebozo techniques that she'll do to help to assist the process in happening quicker. And then lastly, very much just the emotional side of things. So just offering support, reassuring mommy throughout the whole process, reassuring daddy. And oftentimes that's for me one of the most special places actually, is to make sure dad is also involved in the laboring process. Lots of parents, when they come to me and I talk about the doula, they'll say, no, but that's what my husband is here for. And it's great.
You don't want to drop that on him.
It's great, but it's a lot for them because they have even less of an idea of natural childbirth than you have, because most moms do lots of research. Dads are not watching videos on how to massage my wife during labor. And very few of them understand how long the process is going to be. And lots of times moms will wake the dad up when she's having contractions. So he's also not getting any sleep. He's anxious. He doesn't know, is this normal? Is it not normal? So they really have a great role in involving dad, reassuring him, saying, you know what, just spend some time with her, just hold her hand, or she's maybe experiencing a specific type of pain, you can do some massage. So they're great at just bringing that whole situation.
Is there always
together
in the team a doula and a midwife, or can you have a midwife without having a doula, but you can't have a doula without a midwife?
Yeah. So technically, look, everyone's choice. If you choose to have an unassisted birth, that means that you have a birth where there's no medical practitioner involved. So some people do unassisted births, meaning they'll birth at home with no medical people present, and they might choose to have a doula just to give them that emotional support. The important thing to know is that the doula is not responsible for you or your baby's health. So if something goes wrong, she is not trained.
So it feels like you're not really taking enough precautions with that scenario, because no one is medically evaluating the birth and the processing of the birth.
Yes. And so to some degree, sometimes I hear these stories and I think, wow, that's so beautiful. Maybe we can all just have unassisted births. But again, when something does go wrong, that's really when you want your team there.
And you want someone who can notice markers.
Yes.
Like you said, you don't want to know when it's already a problem.
Yes.
You want to know a problem is going to be in the next 2 hours. So let's do something now so that we don't have a problem.
Exactly, absolutely. So to answer your question, I do feel the responsible thing is to have a medical professional there. You can have a midwife without having a doula. I highly recommend. I've almost made it so that it's almost compulsory for me now, if you're a first-time mommy, to have a doula, because I've seen the benefits of it. I mean,
agree.
the studies show that if you have a doula, I think you 50% less likely to end up in a C-section. That's an amazing statistic.
Yes.
So for me, absolutely. And oftentimes when people don't have a doula, they expect of me to doula as well, which is fine. I do consider myself a sensitive midwife, so I do try to rub the back and hold the hand. But, you know, when push comes to shove, my first responsibility is the medical.
Yes.
And then the emotional after that. So I recommend having a midwife and a doula.
When me and my wife had the conversation of doing natural birth, doing a home birth, all of this, I told her we can do that. I respect your knowledge firstly, and I want you to be able to do it in the way that you want to do it. I'm going to support you fully. But I don't want you to have me making the difficult decisions. So I said, let's get the team around us. We tell them, this is what we want to do. But if you tell me during the birthing, listen, I'm in too much pain, I don't want to do it, I'm going to say, right, let's wrap this up, let's go. And I don't think that would have been the best call.
Yeah.
So let's get people who know, and they're going to advise us during the whole process. And that's what you and Natalie did. And that's what made it so much easier for me specifically. And I think for Nikki, because I could tell my wife, no, you're fine.
Yeah.
Listen, what do you know? How do you know if I'm fine? But
they said so.
Yeah, but having someone who knows, tell her that she's fine, then I'm fine as well. And of course, this whole conversation is based on the fact that we had a very successful home birth. And I know that is not always the case. What can mothers do if they think they want to have a natural birth? What are the next steps?
I think it again goes back to the antenatal classes, to make sure you as well prepared as you can be.
And that's something that you do.
Yes, that's something I offer.
It's a blooming business, Bloomsy, right?
Yes, that's correct.
Okay, and you're based in Pretoria East.
Yeah, in Moraletta.
You're very popular. I know you're very busy. And we also have a lot of friend connections. This one knows your sister. And,
Small world, yeah.
But so the first thing, if people consider it, they must come for a class.
I recommend that. And, you know, I used to have my classes, it used to be 2 days, 8 to 4, I think. And then I realized that so many people would come for these classes, like 32 to 36 weeks pregnant, and they would say to me, oh my goodness, I wish I knew some of this information long ago. It's a bit late. You can't necessarily say, oh, I now want to do a home birth and, you know, leave my current gynae. So I then changed my classes, and I now have an early pregnancy class, which literally moms can pee on the little stick and then come to the class, which basically just teaches you pregnancy, like the first trimester with all its beautiful symptoms, you know, what to expect, what's normal, what's abnormal, and then the different kinds of births you can have, talking about water birth, talking about natural birth, or cesarean section if that's what you opt for, the pros and the cons of each, and then how to choose your birth team as well. So I think that is the most important thing.
So it's very informative.
Yes.
Listen, you have a lot of time to think about these things. Here's all the information.
Yes.
Because I don't think there's really another place where a person can you're not going to get this information at the hospital.
No, unfortunately not.
I really don't think you are.
Yeah.
And if you're going to get information, it's going to be skewed information. And I don't think it's, well, it might be a little bit wrong of them, but they are incentivized.
Yeah.
Of course, they want to schedule the financial implication. Of course, they're going to get paid if they do a C-section. So all of those things, they're incentivized. You must know this when you get information from them.
Yeah.
Then, of course, you are also incentivized. You are getting paid to do a service, of course. I mean, it's obvious. And people mustn't think this is not a charity case. That's not.
Yeah.
You're a professional, trained person
Yeah.
who's delivering a service. So that makes a lot of sense. But the only difference is you are prepared to discuss both sides,
Yes.
where the hospitals are not.
Or not. And
Yes.
that's such a it's so sad. I always say to people, that's one of the big problems I think we have in South Africa is, overseas, midwifery is a big thing. And like you mentioned, lots of people, or most people, will deliver with a midwife or deliver naturally in a hospital, oftentimes also with a midwife working in the hospital, and only do C-sections if they are absolutely necessary. And in South Africa, I feel like oftentimes, or a lot of the gynaes have if you contact them, they'll say, oh, I don't work with midwives at all. And I think that's such a sad thing, because there's enough business to go around. And I really think, the gynaes that I work with and that I have relationships with, it's such an amazing and beneficial relationship, because I get to serve my client and give them this home birth experience that they want, knowing that they can be completely safe and secure in our backup plan being organized and in place. And if during the pregnancy she does get high blood pressure or whatever, then we know, okay, it's not a panic situation. We're just going to plan B and we're not delivering in hospital. And these gynaes are pro-natural. So even if you go to the hospital, they're still going to have your best interest and your plan A in mind. They're going to try and push for that natural birth as well. They're not going to force you into a C-section if it's not absolutely necessary.
Do you feel that your profession is picking up? Because on the periphery, I can feel that in like friend groups and so on. Firstly, it's more discussed because it feels like the health and wellness space is really picking up. If you can see the amount of people that are doing cold baths and saunas and looking at their health.
Yes.
I mean, this is something concerning your health.
Absolutely.
And the health of your baby. And it would be beneficial to consider it at least. But it feels to me like there might be a bit of change in the people's perspective on this.
I agree. I do agree. And I think, there's probably various reasons for that. But I think the number one is, especially us younger people, the grannies and grandpas are not always so keen. I've got lots of clients coming to me saying, my parents know nothing about this home birth. I'm not telling them anything until the baby is here safely, because I'm going to get so much judgment. And especially the Afrikaner has a very, whatever the doctor says is what must go. And it's irresponsible to not be in a hospital setting. So lots of our young people or childbearing people, I will say, are moving back to the more natural. And we see this with everything. I mean, people are more conscious about the medications they take, the foods they put into their bodies, which is amazing. And birth factors into that. So yes, definitely picking up. I think COVID also had a bit of an influence there, because I really saw during this time moms and dads who just obviously didn't want to go into the hospital setting. Dads weren't allowed in. And then again, also the people who don't have the financial means. So I do see lots of younger people who don't necessarily have medical aids yet, who find themselves pregnant, unplanned maybe, and they say, okay, we don't have a medical aid, but we really don't want to go to a government facility as a first choice. So definitely I would say it is picking up.
I would also think hesitance of just believing what people in white suits and white coats tell you. I think a lot of people have become very wary of what they're being told, and I think that's a good thing.
Yeah.
Because in my scenario, after my accident and operations and everything, I was put on medication long term. Listen, you're going to have to drink these medications for the rest of your life. And I've been to multiple practitioners after that. The one just saying, no, the other one didn't know what he was prescribing you. You shouldn't be on this medication for more than 2 weeks.
Sure.
But I'm going to give you something better for the next 10 years. And then I had to go and do my research and, try to fuss out what is what. Why are all these people telling me these things? Like most wheelchair users die not because of their injury. They die because of organ failure, 30 years later, because they were drinking medication for all of those years.
Yeah.
And then I got very hesitant of everything.
Yeah.
And that's maybe not a good place to be also, because it's leaning too far to the other side.
Yeah.
But I'm very hesitant. If someone tells me something, okay, I'm going to let's put that on hold. I'm going to research it from my side, and then we can talk again. But unfortunately, when doing that, I noticed most of it was wrong.
Yeah, which
and
is
I
not
need
a
to
good
take
thing
it into,
to realize.
Yeah, and now I need to take it into my own own hands, because no one is going to be accountable for my health in 30 years.
Exactly.
It's just going to be on me.
Yeah.
So, and I feel the same about this. I think if it's possible, it's probably a good idea for the health of the mother and the baby. And
Absolutely.
You should definitely consider it.
Definitely. And again, you asked how can these moms prepare, and doing their research is an answer. You like we said, you're going to get both ends of the spectrum, but still seeing what's out there. I know especially, the older people will say, we've been giving birth in hospitals for how many years? What is it with all these people now wanting to do home births and birthing unit births? Like, why fix something that's not broken? And then I remind them, but it's recently actually that we started birthing in hospital.
Yeah, maybe 100 years if we're talking long term.
I think it's about 200 years. And the reason was
what
not for
before?
Emergencies. Exactly. The reason was for pain relief, because, I want the option of pain relief. Let me rather go to hospital. So we've medicalized something that is not a disease. And so that's why I always also try, and when I refer to my moms, I refer to them as clients, because they're not really patients. There's nothing wrong with them.
Yes.
And just by speaking to your wife as well, and her expertise on pregnancy and like exercise during pregnancy, which when you go to most care providers, and this can be midwives, gynaes, whoever, they'll tell you, but okay, you're pregnant, so you can't do strenuous exercise right now. And that is so far from the truth. So we go to our doctor and they tell us A, B, and C, and we go home with that, not really thinking more of it, but definitely doing your research. And I do feel like going to a specialized person is also ideal. So if you do want to exercise during your pregnancy, go to your biokineticist. Go to a biokineticist who works with pregnant mummies, so that she knows, or he knows, what your limits are and how to work on these things.
Like my wife.
Like your wife.
A small tag, Nikki Meyer, biokineticist.
That's right. So, and that's the thing. We also, I get this idea that oftentimes moms come to me and they feel like a gynae is a one-stop shop. So when you go there and you do have back pain, for example, it's good because it's a gynae. They can prescribe. As midwives, we don't prescribe, pain medications for them. And they feel like that's good. I can go there and all my needs are attended to. But actually what we want to do when you're having back pain is to go to the biokineticist, to go to the pelvic floor physio, to go to the chiropractor. So there's lots of natural things that we actually want to do before we jump to medicines.
Yeah, because people forget also, but all these medicines, they have symptoms.
Yeah.
And most of them are negative. Some you don't realize immediately. Some have long-term effects. So anything that you don't have to drink that you do drink might cause a problem. You want to do it natural.
Exactly.
And it's going to be beneficial in other ways as well. Postpartum, being active. I think, I can't speak for women's health, but after having a baby, you want to do some things outside. You want to do some things active. That's for your mental state.
For your mental health. And that's one of the first things. And the one psychologist, Fiona, she often talks at my antenatal classes. And she always says to people, when you go to a psychologist and you're struggling with your mental health, one of the first things they ask you about is your exercise routine. Mm-hmm. Because we know that, not only does being outside and having that change of scenery already make a world's difference, but being active, just again, your body naturally releases those feel-good hormones, which helps you feel better. So yeah, absolutely, exercise is so important.
Has better results than SSRIs.
Well, there you go.
Depression medication, I mean, so if that's not a good enough, I mean, it's not nice. Most of the time, exercise isn't nice.
Yeah.
Some people enjoy it, but even if you only do it for the benefits, that's good enough.
Yeah. Yeah.
I think so.
No, it is. And I always say, medications are good for one thing and bad for 2 or 3 other things. So that's what we really need to pay attention to. But we live in a culture where, everything is now. If I'm ordering, I want same day delivery, everything at the touch of a button. So we want my back is sore, I want it fixed today, give me a pain tablet. But hopefully we're moving away from that as well. And
it does feel like that a bit to me.
Yeah.
The awareness of people that I come into contact with, it's increasing. It's becoming better. That's what it feels like to me.
Yeah.
And when I look at how busy you are, that it says that I'm having the right thoughts here.
Yes, and I mean I'm still a very small practice, so I really don't do much more than 4 births a month. That's actually where I cap, just for my own sanity. But there are midwifery practices that really are booming, and so I'm thankful for that. I think one other bad thing in South Africa is you can't study midwifery. So when you do want to become a midwife, you have to study nursing first. And lots of people look at, bedpans and broken hips and all these things, and they go, no, I'll rather go a different field. And that's something that a few of the people in the midwifery community are working on, to really try and get, a course in South Africa where you can do a degree only in midwifery. Because I think that's another thing is, the more midwives there are, again, the more natural births we'll probably have happening in these units.
There's a big sum of people that would be an option for them. Because if we are saying 80% of people get a C-section, there's a lot of space for midwives to get into the business.
Absolutely. And it all just starts with education and having the conversations. And I think, thank you again for having me. I think if there's one thing I just want people to take from it, it's that it's just as responsible to have a home birth or a birthing unit delivery as it is to have a hospital delivery. Sometimes dads will say to me, but if you're in hospital, the theater is right there. So if we need a C-section, we go straight in, we go for our C-section. And that's not truly the case. I mean, if you're there, let's say a weekday, and you need a C-section at 2:00 in the afternoon, generally, the theatres are busy at that time. So we still have to wait for them to finish up, do their thing, clean theatre, get it ready while they do your paperwork, and then they take you in.
The probability increases
drastically.
By a lot.
Drastically, yeah. Whereas if it's at night, the team has to be called from home, and I used to scrub at Unitas Hospital. So you've pretty much got an hour to get there and get everything ready for the mommy. So they have everything prepared. Theatre is, if it's an empty theatre, it's set up for emergency C-sections, but the team still has to come from wherever they are. And when we do our home birth, or we do a birthing unit delivery, we have our backup gynae on standby. So if we need them, we call them on their cell and we tell them, listen, this is the situation we're going through. We let the hospital know we're on our way with so-and-so's patient, and they already start preparing and getting everything ready. So it's just as responsible as birthing in hospital.
Yeah. I don't know if it's really the same as an example, but you don't stay at the hospital because you might get a heart attack.
Yeah.
I mean, it's set up for emergencies, and being pregnant is not really an emergency in most cases.
Exactly. And I think, this is also what I tell my mummies at the antenatal classes. If you are prepared and you know what to expect from natural childbirth, and you know what the stages of labor are and how to, what to do during those stages while you are still at home, then you're also giving yourself a higher chance at having a natural birth in a hospital setting, which is also important. So we often find that a mummy might be, 1 or 2 centimeters dilated. Labor really can still go on for a couple of days at this stage, as long as your waters haven't broken. And they go to the hospital because they're scared they're not, they don't know when to go. So they just go to the hospital. And the hospital, instead of sending them home, will say, well, you're here now. We may as well admit you and we'll just wait for labor to progress. But what often happens is now we're in this environment that's quite cold and clinical. There's a nurse that you've never met before that wants to maybe do an internal check. All those things spike your stress hormones. And that's like a seesaw with your oxytocin. So now when those stress hormones go up, oxytocin drops, and oftentimes mommy's labor will stop completely, which is not a problem. That mommy can go home.
Maybe because of the environment.
Usually,
Probably.
yes. That definitely contributes. And so, now you're in hospital, they come and check you again 4-6 hours later, they see, there hasn't been much change. C-section for failure to progress. So if those mummies just can educate themselves and know what to do while they're at home, natural pain relief methods, taking warm baths, going for walks, whatever it may be, having a doula present while they're still laboring at home, it just gives us the higher likelihood of having our natural birth in the hospital setting as well.
That is great.
Yeah.
I think it is tremendous what you're doing. Thank you for your work. And I think we have benefited a lot from this, and I think that is the way in which we will do all of the children which we have going forward.
Thanks so
we have
much.
had a really good experience, and I would highly recommend you as a midwife to anyone who's listening or anyone who's considering this.
Thanks,
Guernsey
Leru.
is the way to go, and we have had a very good experience.
I'm so glad, and it's such a privilege being at every healthy baby that's born is just amazing. So I really do have the best job, and even if people just want to come, I do free meet and greet sessions. So even if they just want to come and ask questions, really the goal is to get people educated so they can make informed choices. So even if they just want to come and have a cup of coffee, see what the birthing room looks like, see talk about their questions and their concerns, bring their dad or their mom or their husband with, they're welcome to reach out to me for that as well.
Okay, and the best place to reach you? Instagram, Facebook?
Yeah, I would say WhatsApp is the best way. So
you don't want to give your number.
no, my number is everywhere.
Okay, you
Yeah,
can give your number if you
they're
want to.
welcome. Yeah, that's the easiest way. So that's 082 444 8994. On Instagram, I'm Bloomsy Baby, and Facebook, Bloomsy Mom and Baby. So any one of those is good, but they're welcome to reach out on WhatsApp as well.
Perfect. Thank you so much,
Awesome.
Frané. I enjoyed our conversation.
Thank you.
I feel a bit more educated around the topic, and I think you're doing a tremendous job.
Thank you so much. There's lots of things that I kind of touched on, and then my mind went drifting. So people are welcome to reach out. But it was
Our conversation works.
such a pleasure being here, and thank you for having me.